Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about getting retraining for medical coding when you have previously gone through a program. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I got a very good comment from a viewer last night who was asking about this. She had been through a program before and she was wondering, should she do a refresher? Can she do a refresher? So I'm gonna go ahead and read her comment and then we'll get into it. So let us begin. All right, so she says, thanks for all of your information. I am a graduate of Medical Billing and Coding Diploma Program. Unfortunately, it was in 2015 and my program was before the ICD-10-CM was introduced. So I received ICD-9-CM training. Although the program was extensive and 18 months, like you said, information is forgotten after only a few months. So my huge question is, how do I get a refresher course and ICD-10-CM? In ICD-10-CM. Any information would be appreciated at this point. I think at this point, if you have gotten training back in 2015, October of 2015 was when ICD-10-CM was implemented, and ICD-10-PCS as well was implemented here in the US. So getting training before then, obviously all ICD-9 stuff, but I think my response would have to be that you're going to have to go through a completely new program all over again. You're going to have to learn everything, not just the diagnosis coding. If you have been out of your program since 2015, there's a good chance you have forgotten all about CPT, HCPCS, E&M, and everything else. There was a change in January of 2021 about E&M as well. So that's why I say if you're going to want to get started again, you're just going to have to go through an entire program and learn it all over again. Now, the good news is you've had some training, so you do know about HIPAA and you will recall your medical terminology and your anatomy, which is a very good thing because when you are restudying again, that is your biggest hurdle, is that medical terminology and anatomy and pathophysiology. That stumps a lot of brand new medical coding students. So if you have that out of the way, that is a really good thing, like I said. But when you are searching for a program, you can either go through the same avenue that you went through the last time to get your training, or you can try the independent route. I do have an independent syllabus, and I will leave the link for the video for that independent study sequence in the description box below. In the description box of the independent study video, it does also list all of the books that I recommend, so that way you can have a sort of a guide to be able to go through. Or if you're asking me what programs do I recommend, I have not been to these other trade schools, nor do I have a relationship with any trade school, and I do not get paid for talking about AHIMA or AAPC. I just mentioned both of these because this is what I recommend, because credentials with AHIMA or credentials with AAPC are what employers are looking for when they are looking for medical coders. So if you want to be taken seriously in this field, you do need to be certified with AHIMA or AAPC. AHIMA being the American Health Information Management Association, AAPC being the American Academy of Professional Coders. You can choose either one. Both of them have their own online medical coding programs. AAPC is very, very interactive on theirs. That when you go to the website for AAPC, it will pop up, how can we help you? How can we help you? They have a really great customer service hotline. AHIMA has a 13-course bundle, which if you pay for the bundle, it will they will give you a year to complete that program. AAPC is a little different. They have their medical terminology and anatomy and patho in separate from the medical coding. Medical coding is completely different and it is by itself, and it is just a few months. I believe it is 4 months for the medical coding side. You'd have to check on the AAPC website. But if you need a little bit more time, you have to pay to extend your time. But that is something that you can check out on the website, so that way you can see which path you want to go to. If you were studying way back when and you just never sat for your certification, at least you have an idea of which certification you want to go for, all right? So if you are thinking about, well, was that a good certification that I was looking at? You can always look in your area for medical billers and coders and see what certification they are looking for in your area. Now, if you're certified with a HEMA or AAPC, they will look at you. I mean, because that is what the industry is asking for. A lot of people will say, well, Blue, everybody in my area is AAPC. It doesn't necessarily mean that they won't look at you just because you have an HEMA credential. I am one of less than a handful at my facility. It's 3 of us that have a HEMA credentials. Everybody else is AAPC certified. So it is okay. I am totally fine with that. I don't mind being, very, well, she has a HEMA credential. I don't mind that in my facility at all. So it really all depends on where you're going, what you want to do, where you want to work, right? If you want to work in an outpatient setting, naturally you're going to have, some good selection of credentials to choose from. If you're looking to code for the inpatient side of the house, you have to make sure that you're paying attention to the certification exam you're going to be sitting for. And if you are getting training in ICD-10-PCS, just make sure that you're getting training in that if you are wanting to sit for an inpatient certification. With a HEMA, the CCA, the Certified Coding Associate, and the CCS, which is the gold standard of medical coding credentials, because this one credential, the CCS, the Certified Coding Specialist, says that you can code, you have mastered both the inpatient and the outpatient setting. The CCA is the entry-level credential. A lot of people still ask for it, but the CCA does get a lot of trash talk. So I had the CCA since 2008, all the way up until this year, March, when I sat for and passed my CCSP. So I am now a CCSP, Certified Coding Specialist, physician-based. So if you're interested in those credentials, check them out. I have tons of videos talking about credentials, breaking them all down. So I am not going to bore you all with the breakdown of the credentials again, but I will follow up and say this. If it's been a while since you've been in school, there's a good chance you've forgotten a lot of it. If you have not been studying, if you have not been practicing with the workbooks, make sure that if you are going to start studying, and you want to study on your own because you've been through a program before, but maybe now you want to take another run at it, but you don't want to go through a program again, that's totally fine. You can totally use the independent study guide to supplement your own studies. Get the workbooks and start working with those workbooks again. It is possible to teach yourself to medical code, but then again, if you need that hands-on training, you can always go through the association websites. Again, those are the only ones I'm going to recommend. Sometimes people will say, well, I found it cheaper at my local college. Yes, sometimes you can find it cheaper at the local college. However, I will say this. Sometimes with a local college, they may have you taking other additional classes in addition to your medical coding course, and it may not even be related to medical coding at all. I have heard of that. Or I've heard that these college programs, they are not training you for a HEMA or AAPC, but they're training you for another association. So keep in mind that I am not going to say who the other association is, because I do not believe in promoting something that I don't believe in on my channel. I will only promote what I believe in, and that is the American Health Information Management Association or the American Academy of Professional Coders. And this goes to show you, I'm not even certified with AAPC, and yet I actively promote them along with the association that I belong to, which is a HEMA. So I am okay with both of these because I want you guys to be able to make your own decisions about which association you want to go with. Both associations have lots of really good positive things about them, and I believe that people are more suited for certain associations than others, okay? All you need is one certification. You don't need multiple, especially if you are just barely getting back into this. You do not have to be certified to be a medical biller. I will always say that because think about all the continuing education units you'll have to come up with. That's a lot for somebody that is going to be brand new again to this field. But yes, absolutely. If you've gotten training way back in the day, we are completely out of ICD-9. No one uses it. And if you say, well, you know, I saw in a job listing, they said that they're looking for somebody who knows ICD-9. You have to keep in mind, guys, that a lot of times these job listings are written by somebody in the human resources department who knows nothing about our field. All they know is medical coder, and then they'll just pull up whatever job description was applicable 20 years ago. They will go ahead and just throw that up there because that's basically what it is, right, to them. But for us, if you really know, and you'll be able to see once you start looking at these job postings, you'll be able to see who knows what they're talking about in these job listings, because they will say, you know, candidate must be certified with a HEMA or AAPC, must have a strong knowledge of ICD-10-CM. If they're looking for somebody on the inpatient side, they may say ICD-10-PCS as well. CPT, HCPCS level 2. They may say, you may see them say CPT-4. That is a CPT manual, okay? So that is just something, the way that the language is written now in these job listings, you'll see that it is, that is what it is. So it's not anything different. CPT is still the same, just with updated codes now and new rules for evaluation and management. But yes, if it's been a while and you've been thinking about it again, that's the thing about medical coding. It will do that to you, right? Where it will maybe be on the back burner because life happens and it's understandable. Some people said, well, I was in school and I dropped out because I had a lot of family issues, and maybe that just wasn't your time to become a medical coder or to pursue that goal of yours. But maybe now that things have settled down and you want to take another run at it again, and you think to yourself, I can do it this time, then you are absolutely halfway there, because it really does take a lot of self-motivation, takes a lot of endurance. And I'm not kidding when I tell you guys, it takes endurance to study medical coding. It is a lot. And when you think about it, you know, we have to know what doctors know. Well, never having gone to medical school, that is the number one thing that I say on my channel, is we do have to understand that. You're not going to be expected to learn everything overnight. You're not going to be expected to know all of the disease processes right away either. So you can relax there. But you will have to start studying and start putting your best foot forward. So if you find yourself on this path, I have tons of advice videos. I have tons of resources that I post in the community tab as well. I have done many videos about resources for medical coders. I do have a Patreon channel if you're interested in that. Patreon, if you don't know, is a lot like YouTube. And Patreon, I will post crossword puzzles to help learn medical terminology. I will do worksheets to kind of help with medical terminology as well as anatomy. And I do medical coding exercises as well. And on the higher levels, I will do critical thinking exercises. So if you're interested in that, the link for my Patreon channel will be in the description box below. If you're going to plan to sign up, I recommend that you sign up after the 1st, because that is when they will run all of the new people. And so you don't want to have to be charged twice, okay? So the option is there if you are interested. So anyway, but yeah, that's pretty much all I have to say. But guys, take a look through my videos. There are so many good videos and demonstration videos. I have some back to the basics. I do have a playlist for back to the basics where I'm sort of talking about the book and reviewing the book, going over the book. So maybe that will help you. But yeah, so I'm going to go ahead and wrap this one up. If you haven't had a chance to subscribe already, I hope that you do. If you like this, please share it, hit that thumbs up button, and I will see y'all on the next episode. Bye.